Welcome, everybody, to another episode of Compliance Reality, where we discuss the realities of compliance enforcement and compliance programs today. Today's topic is when back pain becomes compliance pain. And specifically, we're going to talk about facet-joint injections. My name is Dr. CJ Wolf. I have over 22 years of full-time professional compliance experience, working for organizations such as Intermountain Healthcare, University of Texas System, MD Anderson Cancer Center, and an international medical device company. I left clinical practice many years ago and turned to a full-time career in coding and compliance and revenue cycle reimbursement type of information. From a compliance perspective, I teach at universities, holding faculty appointments, and I spend time as well as a private compliance and coding consultant and trainer. So if you're in the need for some of these services that we might be able to offer, please keep us in mind. We can be reached at info@compliancereality.com. You can also see the multiple certifications I hold as a coder and a compliance professional. So what exactly are facet joints? Well, if you think of the spinal cord, this precious soft material that helps us move and nerve impulses are passed through and out to various areas of the body, that spinal cord needs to be protected, and it's protected by bony vertebrae. And these vertebrae are stacked on one another, kind of like Legos, if you will. And where the vertebrae meet creates a joint. And the facet joint, you can see on the slide, is where these vertebrae meet. Nerves run through these holes and in these areas, and sometimes there can be pain from nerves that are either mechanically pinched or impinged. You can have swelling and various things. We won't get too much into the medicine here, but basically you can get neck and back pain, and doing facet joint injections can help with that pain. And anatomically, there are facet joints. There are two for every level. So there's one on the left, and then there's one on the right, on the other side. So these injections can be performed unilaterally, or they can be performed bilaterally. Obviously, the documentation of what was actually done is important, and then the coding and billing that is chosen to be reported also has to be precise, depending on what was actually done and what was medically necessary. You can also see that these facet joint areas can be named by various levels. On the right, you can see cervical, thoracic, lumbar, and sacral, and then they're numbered so that you can get precise locations of where these services are taking place. And we're going to talk about some compliance issues with doing injections of anesthetic and or steroids into this area, but also denervation types of injections as well. So let's begin with a few examples of some enforcement. So this first press release from the Department of Justice relates to 4 Detroit physicians that were found guilty in a trial. Most of these settlements happen, through a settlement. They don't go to trial, but this one went to trial. The physicians were found guilty by a jury of healthcare fraud, specifically for their role in a fraud scheme relating to facet joint injections for over $150 million. They were essentially billing for medically unnecessary facet joint injections. So they were doing the injections, they were, exposing patients to these procedures when they didn't need them in many cases. And they also, this was a requirement before the patients could get opioid prescriptions. So there was a little bit of couple things going on here, both the facet joint injections that weren't always medically necessary, and those were often tied to opioid prescriptions for some people who were in legitimate pain, but also for some people who were drug dealers. And it was evidence at the trial, according to this press release, showed that the defendants repeatedly performed these unnecessary injections, and they were paid more for the facet joint injections at this particular clinic than any other medical clinic in the United States. So when data analysis was done, they could find that this clinic was the highest paid clinic for these types of injections. The 4 defendants were all ranked in the top 25 doctors for dollars paid by Medicare for facet joint injections, even though they only worked a few hours a week. Some of the testimony given at the trial was that the practice was like an assembly line where the 4 defendants earned anywhere from $1,100 to $3,500 an hour for performing the same injections on nearly every patient. Now, this is the physician's press release, and the next slide I'm showing you here is the CEO of that clinic was also found guilty, was sentenced to prison for participating and partially designing this fraud scheme. In this scenario, the CEO was sentenced to 15 years in prison, but also was required and ordered to pay over $51 million in restitution to Medicare, as well as a forfeiture to the United States of any property that's traceable to the proceeds of this fraud scheme, including over $11.5 million, some commercial real estate, some residential real estate, and a Detroit Pistons season ticket membership. You can see that some of the fraud proceeds were used to fund private jets, luxury automobiles, etc. Now, there were 21 other defendants, including 12 physicians total. So on the previous slide, I showed you 4 physicians, but according to this press release, there were 21 other defendants, including 12 physicians total. So some of this is still working its way through the system, but it was alleged that this CEO was designed and approved this fraud scheme to require these unnecessary facet-joint injections in exchange for the prescriptions, and to just make these injections kind of an automatic type of thing that was done regardless of medical necessity. Now, this next physician, this is unrelated to the previous 2, is a Houston physician that was convicted by a jury for his role in a scheme involving about $1.5 million in Medicare fraud and claims. This one involved both home health services, but also facet-joint injections. So this is kind of a mix of a case. The part I wanted to point out was the role of the facet-joint injections. Evidence at trial showed that the doctor paid illegal kickbacks for patients from another healthcare group so that they could bill Medicare for these facet injections that were either medically unnecessary, sometimes they were not provided, and sometimes both medically unnecessary and not provided, according to the evidence at trial. So there are examples of this type of thing going on, and we're going to share with you some other audits that the OIG has been doing. So I think I have 3 or 4 examples of OIG audits. The first one I wanted to share was from a few years back. I believe this was published around 2008, maybe. This was a review that the OIG did titled Medicare Payments for Facet-Joint Injection Services. And what they found in this scenario was that 63% of facet-joint injection services did not meet the Medicare program requirements. And for the audit time period that they were looking at, this resulted in about $96 million in improper payment. Those were to the physicians. And then Medicare allowed an additional $33 million in improper payments for facility claims. So one of the conclusions that they made was that facet-joint injection services provided in an office were more likely to have an error than those provided in an ambulatory surgical center or a hospital outpatient department. Continuing on this particular audit, these are some of the different kinds of errors that they found. 38% of facet-joint injection services had a documentation error. What they mean by that is that the documentation in the procedural note was not complete enough or not full enough to demonstrate what was done or billed for. 31% had a coding error, meaning the codes, the CPT codes or ICD codes that were chosen were not accurate. Next, for services that did have a coding error, just over 60% were overpaid because physicians incorrectly billed additional add-on codes to represent bilateral facet joint injections instead of using modifier 50. So let me explain that one a little bit. These codes are based off of level, and if you do multiple levels of injections, there are add-on codes. At least at the time of this audit, there were codes that you'd add on for every additional level. And that's appropriate if you're doing additional levels. But what this means is the OIG found scenarios where the doctors weren't doing additional levels. They were just doing it bilaterally. They were doing it all on one level, and they were doing both the left and the right facet joint injection. Well, that's one level. So you don't do the add-on code for an additional level. Instead, you use a modifier 50, which describes the service as bilateral. Now, there are reimbursement ramifications for coding it one way or the other, and the way that they were coding it resulted in higher reimbursement to the practice. So there's kind of a financial incentive to want to build those add-on codes at the time as opposed to using the modifier 50. They also found that 8% of services had a medical necessity error, meaning 8% of them, there was not medical necessity for even performing these services. And then 14% of the services had one or more overlapping errors. So this is a really interesting read. It starts to paint the picture of issues with facet joint injections from 15, 13 years back. And I'm going to bring you forward with these additional audits that they've done. So the next audit you can see looks like it was around 2020, so just about a year ago. Medicare, it's titled Medicare Improperly Paid Physicians for More Than 5 Spinal Facet Joint Injection Sessions During a Rolling 12-Month Period. And I'm going to explain this a little bit. But what they found in this particular audit, for the audit period that they covered, the MACs, so MACs are Medicare Administrative Contractors. These are the entities that run Medicare for various geographic regions in the country. So the MACs in the 11 jurisdictions that had a coverage limitation made improper payments of $748,000. So MACs can have what are known as LCDs, or local coverage determination policies, which are policies specifically written for certain kinds of services. And what they found in this particular review is that the MACs that had such policies often had a coverage limitation. It would say something like you could only do 5 spinal facet joint injections during one session, or you could only do so many sessions in a 12-month period. So there were limitations, meaning you could do some injections, you just couldn't do them all the time. It wouldn't be covered. The doctor can do it, but the patient would have to pay, and we know that a lot of times doctors just don't want to be asking patients for that, and they just bill Medicare. And what this review found is that even though there were policies saying you couldn't do that, there was reimbursement for that happening when it went outside of that coverage limitation. So continuing here on this next slide, these MACs developed this limitation of coverage, as I just described. And the coverage limitation allowed physicians to be reimbursed during a rolling 12-month period. And during that rolling 12-month period, they could only be reimbursed by Medicare under this policy for a maximum of 5 sessions in which facet joint injections are delivered to the lumbar region of the spine. That's one of the lower areas. And a maximum of 5 sessions in which facet joint injections are delivered to the cervical and thoracic regions of the spine, or cervical thoracic spine. So those were the limitations set up. And when they did the review, they found out that physicians were exceeding that, submitting claims for that, and being reimbursed out, and that was outside or against these limitations of coverage. And so they should not have been paid for those things outside of those limitations. Here's an example of one that they posted or shared in the report. That in particular, one beneficiary received 21 facet joint injection sessions related to the lumbar spine during this rolling 12-month period. And the physician who administered these injections billed and received payment for all 21 sessions instead of just the first 5. So as a result, the physician was paid $4,200 instead of $1,300. And so the overpayment amount was $2,800. And you can see in the image, they're showing that the 12-month rolling period is from January 12th, 2017 to January 11th, 2018. They show the first 5 sessions, 2 in January, 3 in February. Those were what were covered according to this policy. What should not have been covered were the additional, 16 sessions in that 12-month period. That doesn't mean the physician can't perform them. They just Medicare should not be reimbursing for those. And so this is an example of overpayment. Now, in regards to overpayment, the OIG has been saying these sorts of things about in their recommendation sections of these reports. Instruct the MACs to, based upon the results of this audit, notify appropriate physicians, i.e., those for whom CMS determines this audit constitutes credible information of potential overpayments, so that the physicians can exercise reasonable diligence to identify, report, and return any overpayments in accordance with the 60-day rule, and identify any of those returned overpayments as having been made in accordance with this recommendation. What that means is there's a 60-day rule, which means if you identify an overpayment or should have identified an overpayment based off of credible information, you have 60 days to refund it, and the look-back period is 6 years. So what the OIG is saying here is they want Medicare, the MACs, to contact the physicians identified in these audits and say, not only do you have to repay this period of time that the audit covered, but this is credible information that you may have been overpaid for other time periods outside of this audit period, and you may need to go do your due diligence. And all of these terms that I just read to you that's on this slide, those all have definitions in the 60-day overpayment rule. And so the OIG has also said that this 6-year look-back period is not limited by OIG's audit period. So the audit period in this review may have only been, 12 months or 18 months. The overpayments are not limited to that 12 or 18 months, according to the OIG. They're saying that this is credible enough information that practices will need to exercise due diligence to determine, we were overpaid for this 18 months. Should we need to look back for 6 years and see where we also overpaid, for the additional 4.5 years or 5 years, depending on the time period. So this is a big deal. And if you're in a physician practice, you need to make sure you're following this 60-day rule, because the OIG is putting it out there saying that this is deemed credible evidence that you had overpayments even outside of our audit period. You need to do your due diligence and identify that and return overpayments. The next audit that was published was in February of 2021, and this one was specific to one of the MACs. Noridian Healthcare Solutions is one of these Medicare administrative contractors, and they just focused on one. And they concluded that Noridian, on the basis of their sample results, OIG estimated that Noridian improperly paid physicians $4.2 million for facet-joint injections for their audit period. So let's dive a little deeper into this one. Here is a summary of some of the facet-joint injections that did not comply with these regulations. They categorized them by, and I'm going to give you examples of some of these in a few slides. They categorized them by general procedure requirements that are required in the policy, and if you didn't follow those, that they shouldn't be paid. That was 37. 12 of these beneficiary days were requirements related to spinal levels. 8 requirements related to indications of pain. 4 requirements for therapeutic injections. 3 requirements for diagnostic injections, and 1 a limitation of coverage requirement. So let me show you a few examples of what some of these categories mean. So for examples of facet-joint injections not meeting what they called general procedure requirements, this slide and the next, I give you 4 examples. 1, the physician's procedure notes did not include all of the required elements, e.g. pre- and post-procedural pain assessments. So that was a requirement from the Noridian policy that if you didn't do that, that means you would not be covered for the service. Next one, a physician administered injections under ultrasound guidance. So there was in that Noridian policy, there were certain requirements surrounding this. Next, total medial branch block anesthetic volume exceeded 0.5 milliliters per medial branch nerve for diagnostic purposes, or 2 milliliters for therapeutic injections. These are very specific requirements from the Noridian local coverage determination policy, or LCD policy. The point I'm trying to make here is that If you're in Noridian's jurisdiction, you have to follow that policy. If you're in another MAC's jurisdiction, you need to follow that LCD because there may be similar requirements in it. And the last example for this general procedure requirements category is more than 15 milligrams of betamethasone were injected during an injection session. So you can see that the findings are getting very, very specific as to why they are not covered. Next category. So here are examples of injections not meeting what they called requirements related to spinal levels. So there's 3 here. Physicians billed for injections administered to 3 levels of the spine, even though the medical records indicated that the injections were administered to only 2 levels. So they made an error, but they billed for more than what they did. Second, a physician billed for bilateral injections, but actually administered unilateral injections. So if you only did a unilateral and you bill for bilateral, you're getting paid a little bit more. A physician billed for unilateral injections, but actually administered bilateral. So that's kind of the flip. So they may have lost some money there, or they may have billed a bunch of unilateral injections with additional levels, and that could be a problem. Either way, these are some errors that were found due to or related to spinal levels. Now, there was a category as well for examples of injections not meeting requirements related to indications of pain. So here are some requirements according to the LCD policy for Noridian, and if these are not met, you're not covered. Beneficiaries did not have a history of at least 3 months of moderate to severe pain with functional impairment. So that had to be documented. Second, beneficiary's pain was in multiple regions and not predominantly axial. So what that means is axial is a certain region of the nervous system that has to be demonstrating the pain. And if the pain is in other areas outside of these areas, then they're saying this is not covered under the facet-joint injection policy. Third, a clinical assessment did not implicate the facet joint as the putative source of pain. So that's another requirement. You can't just be doing joint injections because somebody has pain. You have to do assessments that implicate the facet joint as the area and the problem that is the source of the pain. And then there's, on this next slide, there's one more example of something not meeting the requirements related to indications of pain. The source of beneficiary pain could be explained by a non-facet pathology. For example, one beneficiary had spinal stenosis, which is a narrowing of the spaces within the spine that can put pressure on the nerves that travel through the spine. If it's spinal stenosis, the facet joint injections is not going to be the procedure of choice. So these are all very, very specific findings that are specific to the Noridian LCD. Again, my point is, in your jurisdiction, you need to find your LCD, read all of the requirements, because that's what Medicare's doing here. What did the OIG say now for this last audit that was recently published, December 2021? This has to do with Medicare improperly paying physicians for spinal facet joint denervation sessions. So denervation sessions are different than anesthetic injections, but the concepts are all very similar. OIG concluded in this scenario that in total, Medicare improperly paid physicians $9.5 million for their audit period. These improper payments occurred because CMS's oversight was not adequate to prevent or detect improper payments for selected facet joint denervation sessions. So let's look at a slide that kind of talks about this a little bit more. The MACs, again, those Medicare administrative contractors for these 11 jurisdictions that had a coverage limitation of 2 facet joint denervation sessions per beneficiary for each covered spinal region during a 12-month period, made improper payments of. So that's a mouthful. But basically what they're saying is some MACs had a coverage limitation saying you're allowed to do 2 denervation sessions per 12-month period. And if you did more and you billed for more and were paid for more, that is outside the coverage. And that's what OIG found, is that physicians did more than 2 sessions. Again, there's nothing wrong with doing the work, but the problem comes in billing, because when you bill for it, you are billing for services outside of the limitations of coverage, and you're getting paid for it. And so OIG did this audit to say how much of that went on. Well, for those MACs with those 2 facet-joint denervation sessions per beneficiary for a 12-month period, they found 7.2 million overpayments, consisting of 5.5 million in payments for more than 2 sessions related to the lumbar spine, and 1.7 million in payments for more than 2 sessions related to the cervical and thoracic spine. And then there were some other MACs involved that had different coverage limitations. So some MACs said you can do 2 sessions per 12-month rolling period. Other MACs had limitations of 10 facet joint denervation sessions per year. And for those, OIG found improper payments of 2.3 million. And of that amount, approximately 2 million represented payments for sessions that had denervation of more than 4 or 10 facet joints related to the lumbar spine, and about 330,000 represented payments for sessions that had denervation of more than 4 or 10 related to the cervical and thoracic. So this all depends again on the MAC's jurisdiction and their specific coverage limitation. So the take home here from this session about back pain becoming compliance pain is you need to follow the policies for your MAC's jurisdiction. And those can be very detailed. As you saw in some of the examples I shared, they had to demonstrate a certain kind of pain threshold, functional limitations. They had all sorts of different requirements, and those can vary from MAC to MAC. And the policies can change. Maybe 5 years ago it read one way and there's been a change. So you need to have somebody monitoring that, auditing and reviewing. And if you're finding overpayments, you have to follow that 60-day overpayment rule, which often requires a 6-year look-back period. In most of the cases, it's got kind of the default is a 6-year look-back period, unless there's some sort of special circumstances that say, no, we identified the problem and it only started at this time period. So those types of things are important. And if you have any questions about this topic, please reach out to us at info@compliancereality.com. We'd love to hear from you on this particular session and maybe ideas for future topics. And as I've said before, if you need help with your compliance program, please consider our consulting and training services. You can reach us again at info@compliancereality.com. Thanks for listening to another session. We'll see you next time.